Good afternoon, friends. A very happy Dasara to all of you. Today being a very important day, especially for women, I'd like to flag an issue, discuss something with you. Friends, last year, I came to know something that really disturbed me. A friend of mine, she's a medical doctor and she works in a very big hospital. She told me that when the COVID was very high, raging very high, the hospital wanted to efficiently treat the patients. So at the time of admission, they were asking the patients whether they had comorbidities, like whether they had diabetes mellitus or a heart condition. So they took their records and then they were admitted and they were being treated for COVID. Now, what she told me was that some of the women who became very serious, some of them even passed. And when they checked the records, at the time of admission, they said that they had no cardiovascular disease or they had no diabetes mellitus. But their COVID became very serious. And when they conducted tests, they came to realize that some of them had, in fact, most of them had heart problems, most of them had diabetes mellitus. And in fact, some of them, unfortunately, even had early stages of cancer. Now, that really disturbed me. These women, did they not know that they had these problems? Why did they not go for checkup at all? Did they Were they so busy working in their homes that they had no time for a medical checkup? Or worse still, they thought they were not important, their health was not important. What was the scene? What was happening? Now I'd like to place a request to you. What is your understanding of the situation? Kindly share it with me. Kindly share it the link below. Because this month happens to be the month of mental health awareness. Is it that those women were depressed, they were overworked, they were anxious, and they were so stressed that they never bothered about their own health? And they did not come from low economic status. Most of them were educated, most of them were from middle class homes, and middle class homes tend to have educated women. So, what is your understanding about it? It could be women in your own homes. It could be your mothers. It could be your wives. It could be your sister. It could be your aunt. Someone close to you might be actually going through this problem. So do answer this for me. Thank you for listening to my appeal today.